I'm sorry for this whole mask setup, but flu season is definitely upon us. Now I know what you're thinking. Why would you wear this clumsy thing on your face all winter when you can just go out and get a flu shot? So like many Americans, I have some questions about the shot. Mainly, how effective are they? Are there any side effects? And most importantly, can you actually give me the flu? Since I ran with the Yale School of Medicine, perhaps I should get an expert opinion of someone like, say, Paul Jennison, the director of Yale Health, that can tell me exactly what influenza is and if the shot really works. Let's have to take my mask off if we're going into
the exam room.
Well, what flus and colds have in common are fever, respiratory illness with congestion, sneezing, cough, sore throat, those types of symptoms. But influenza or flu is not a mild illness. It's actually a specific disease caused by a specific virus. An influenza illness often brings a patient to a doctor. Early in its course, it can be treated with antiviral treatment that's effective for influenza, but it is a disease that's very important to prevent.
I'm sorry to interrupt, but before we keep going, there are a couple key facts about the flu shot I want to get out of the way. So first of all, there are many strains of the influenza virus. So each year, researchers try to guess which strains will hit the US the hardest by looking at what is most common in places like Australia, where their winter is our summer. Once they've made their choice, scientists place those viruses in a fertilized chicken egg where they multiply before being extracted, killed, and then placed into the serum that goes into your arm.
On average, it's about 2/3 effective, 55 to 65% effective. It depends a lot on whether a prediction is correct about the strains of flu that will be prevalent next year. So there's a certain amount of looking at a crystal ball. It should be pointed out, though, that flu shots, even when they're not perfect, they're not 100% protection against influenza, do make illness, when it occurs, less severe. One common question that comes up is, can I catch the flu from getting a flu vaccine? And the answer is no. You can't catch the flu from the flu vaccine. However, we do give flu vaccine at the beginning of flu season, and the vaccine is of very little benefit in the first 2 weeks. The flu shot is an extremely safe vaccine. As I said, it's used in literally millions upon millions of people every year, quite safely, and its benefits far outweigh any risks.
Okay, Dr. Jennison convinced me to get the flu shot. It's given safely to over 134 million people each year. It does not cause you to get the flu, and most importantly, when you get the shot, you're not just protecting yourself, you're protecting all of those around you, especially those who are most susceptible to the disease, such as the elderly or the immune-compromised. So, Doc, all right, wish me luck, and join me next month on another episode of The Exam Room. Do I have to take my jacket off first? Ow! Ow! Oh, you haven't started yet?